I always saw it as something that I probably wouldn't be up to doing, and that was what I thought right up until my teacher said, "Tim, why don't you apply?" And I've always been someone to not close doors on myself, and I thought, if I don't apply, I'm never going to get on it. Okay, I'm not the most academically clever person with the people I've worked with. I've averaged, I think it's about 60 to 63% in first year and second year. So I knew that I wasn't top of the class and that I probably wouldn't get it. But I applied because if I didn't apply, I definitely couldn't have been chosen. After applying, I got told that my application had been successful. It was a generic application that I think most of the year were invited to do, and I did my application like I would for anything else I applied for. Like I applied for the different pre-registrations. It wasn't that dissimilar to what I'd sent to the multiples and other people and hospitals that I thought I might hopefully get into. And I applied, and then it was 4 days later I got a phone call saying that I'd been accepted for interviews, and I was to prepare an interview and a presentation for the supervisors that, if I was to get the placement, would be the people doing the interviews, to prepare a presentation for them. And the people that interviewed me on that day, and the people I've been working with today, I was working with yesterday, and the way they came across at the interview was that they wanted someone that would fit into the practice. This fitted in with what the whole thing of, you didn't have to be the cleverest in the class to do it. You had to be a rounded optometrist. They had a chat with me and they wanted to see that I was what I was about, that I wasn't just numbers, I wasn't just grades, and that's what I wasn't. I'm not just getting the grades. Yes, I can get the grade that gets me into the place. I wouldn't be in the situation to apply if I wasn't getting the grades. So yeah, they came across that in the interview, and that's reflected in me being accepted into the placements that suited me. They saw me, they talked to me, and I got chosen to be in the placements there because that's what how I came across the interview. We had interviews for Manchester, Newcastle, BBR Optometry here in Hereford, and Ashington. And speaking to the 4 people in the interviews, the BBR people that interviewed me and it was Kevin Gales from Newcastle, they were the people that I liked the most in the interview and that I wanted to be with, having had the interview. And if I did get it, that I thought they would be the ones to go then. And it turned out that they were the people that chose me as well. So they want someone that's going to fit into their practice, and I think that's what happened. And I've been in here BBR for 3 months now, and it's been brilliant, absolutely brilliant. The house was full of second year students that were actually all took a gap year, so they're all the same age as me, and I lived with those for six months. They had university work. I actually felt for the first time like the free one. They all were going into Christmas exams. There was Christmas exams. Yeah, they were going into Christmas exams. They just come out of Christmas exams and they were going into summer exams. So there was a time of year which is the first time since GCSEs, which I've not been the one doing the exams. So it was such a nice feeling to live with people. Not nice. I enjoyed their pain, but I enjoyed the fact that it was one time that I didn't have to do exams. As I'd been so used to doing them. In the hospital, when I got there, there's a big team of optometrists working. Kevin Gales was in charge, but he said at the start that all the people here are here because they know what they're doing and they're all going to be here to help you. We're not necessarily going to look over your shoulder at everything you do, but if you've got questions, then you've got to know that we are happy to help you. It doesn't matter how busy it is. They were there to help, and they really were. That's what they said at the day one, and on the last day I was there asking Kevin a question, or asking Steve a question, or asking Nicola a question. They were all more than happy to help when asked. But at the same time, they didn't pressurise. You didn't feel like someone was looking over you. To start with, they gave you tasks that you were up to doing. So we just did Logmar visions to start with, and then they gradually built things up until I was doing all types of appointments, the post-cataract appointments, and the way they kind of eased you into things made it. I felt like I adapted. I can't believe what I was doing in my last day. I saw as many patients in my last day as I saw in the first 2 weeks or something. So you really, and there was such a variety of all sorts, and they, every Thursday morning I was timetabled to go into anywhere into the eye department. It could be sit with the ophthalmologists, it could be go to orthodontic, it could have been gone up to see some surgery, and I made the most of that. I sat with almost all the different consultants in hospital. I went into surgery, I saw cataract surgery, I saw glaucoma surgeries, I saw oculoplastic surgery, so lots of eyelid surgery, and I also got to go and see I actually went up with my ophthalmologists to the premature baby unit, the intensive care unit, and we took photos of this 24-week premature baby's eyes. And I was there clicking the button with this ophthalmologist, and it was experiences like that which I'd never get the chance again. It was amazing, and that was just in the hospital. So I've come into BBR after 6 months in the hospital, and already I'm seeing the benefit of being in the hospital. I've seen patients from the start. I've been eased into it, similar to what I was in Newcastle, given to start with a few patients, maybe just 3 a day, and then now I'm doing 7 patients a day with our testing. I do dispensing some days, and the team here is. They're used to having students again. They have M-Optom students for the last, I don't even know, it's almost like 14, I don't know how many years. It's a lot of years. So they're very used to having people, and they've got a very set up network for getting you into the swing of things. And it's completely different to the experience I had in the hospital. There's three optometrists that work here that were M-Optom students that did their placement here. BBR, one of the best practices in the country, wants the best, and the impression I get is that if you've done the Optom, you're going to get into similar practices across the country, and that's reflected with who I'm working with today. Nick Rumney, he's the main supervisor here, and he's off to Colombia doing talks about independent prescribing. He goes to the AOP, different things. He's up for awards there. We're going down to a site care conference with him, which is for independent practices, and I've been invited along. Okay, it's not that much, but it's about the business side of things, which is something I'm learning, which I never have got in the hospital. Supervision-wise, it's not like the hospital in which I could go see anyone at any time. Each day I have a set supervisor, so one day it'll be Mr. Remney, one day it'll be Laura, and I just go to whoever's supervising that day, which is really going to get everyone's variety of inputs on the different things and how they deal with different patients. There was one experience which I had, which was a glaucoma patient. It was borderline whether you would refer or not, and I had a discussion with my supervisor, and she asked me what would the hospital do, and I thought, I've sat in these clinics with the hospital, and the patient would have just been seen in 6 months' time, and they would have looked at it and thought, okay, we'll just see it in 6 months' time. So we decided not to do anything with it and just see them back here in 6 months' time. And it was only by being in the hospital and knowing the type of patients that they do things with that I was able to give my opinion on that, and it was what we decided to do in the end. They've got all the top equipment you can see. The equipment we've got Optomaps, we've got OCTs, we've had a recent dry eye piece of equipment called the Lippy Flow, which is a new piece of equipment from America. A couple of weeks ago, there was engineers flown into Heathrow overnight to come and fit this machine, and then another lady was flown in to teach the optometrists how to use it. And this is a piece of equipment which is at the forefront of dry eye treatment, and that's what this practice is. It's at the forefront of optometry. So we're given the task of writing a data collection dissertation. So what that means is we've got to collect our own data for a write-up of a study. It's a small-scale study, and at the start I was pretty like, oh my days, what am I going to do? Because it's got to be this. I've read all these papers and they're so hard to understand. Because I've never been one to really enjoy reading the papers. I feel like it's a case of having to do it rather than wanting to do it, and that's something I was quite. This is probably the thing I was least looking forward to. But as soon as I got into it and I realised that the point of writing this dissertation, it's not so you can produce this perfect dissertation that's going to push back bounds of optometry. It's going to be something that's going to give you the skills to progress further in the future. My dissertation is on visual acuity before and after dilation with 1% tropicamide, and that's basically just going to tell me how much does people's vision change after we dilate them, because there's this big question on whether people should drive or not. So it's just a simple thing. I'm just measuring the vision of a patient before I've dilated them and afterwards, and I've got to write that up. And all I've got to do is write what I did, why I did it, and then discuss it. It is going to be a long piece of work, but it's only what I've been doing, and the reason, and because I've been doing everything towards it, it should be okay to write about it. The dissertation side of it has been a lot better than I was expecting, a lot easier than I was expecting. I mean, it's still going to be tough, but at the end of the day, we're getting a master's out of it in the same time everyone else is getting a BSc. From speaking to people, and the people that I've met that have come into contact with the MOptoms in the past, that they're in the best situation to go wherever they want in optometry, and that's something I'm really hoping that I'm going to be able to do as well. I've been told that we can go into hospital quite easily because we've worked in a hospital and a practice, and we've also got the benefit of having the practice side of things when going into hospital, which again is the opposite to what I was saying before about the knowing what is seen in hospital and what's seen in practice. It's going to be easier for me to go into hospital, and it's going to be easier for me to go into practice with the experience for both. If you don't do the MOptom, you categorically either do it in a hospital or you do it in a practice, and going from a practice to a hospital is very difficult in terms of the training you've had, and going from a hospital to a practice is very different. You're going from a very clinical environment to almost some kind of sales environment, and it's that contrast is different. But the way the fact that I've learned in these two environments, is like this is when I've done my learning. It's not like I've done one and I'm going to work in the other. I'm not expected to. I'm expected to need to learn in these environments, and that's provided me with a different kind of. It is providing me with a different kind of education. In terms of further education, I think the opportunities there. I'm already on the path of doing those, so a PhD is going to be a possibility. Neelam, who is a MOptom that works here at the moment, she's just finished her PhD, and also somebody else just starting a PhD. So it's a step forward in term, and we haven't lost any time in years. Like I'm qualified hopefully in June in the same amount of time that I would have qualified anyway.